talk about. Important. So, the Coalition is a membership organization of 65 different groups from across the country. In New York, we have two of our founding members, the Center, where Terry works, and also Callan Lord, and all of the 8 community health centers around the country that focus on the health needs of LGBT individuals are members of the Coalition. And what we aim to do is to talk about LGBT health needs on the federal level. So I go into a lot of non-LGBT spaces and talk about what that looks like and how LGBT health needs are really similar to most people's and also have different pockets. And the other part, which I'm not going to talk about as much tonight, is talking to the LGBT movement about why health is actually an important civil rights issue, and trying to expand out what we see as necessary for LGBT people to have a really good life. So I'm going to talk really briefly about what makes LGBT healthcare different. And I'm going to do it by using our 4 little letters. So for L, it's a lot of what you spoke about the need to access infertility care, sometimes at an earlier space to be able to access a sperm bank or artificial insemination. For a lot of insurance companies, you have to show that you've been trying for a year in order to be covered under infertility care. That's really fairly easy to do if you are a woman partnered with a man. You go to your doctor, you say, we're trying. They say, okay. You come back in a year, you say, we haven't conceived, and they say, okay. For 2 women, that would be 12 months worth of buying from a sperm bank, right? And about $500 a pop, you're talking about $6,000 outlay before you can get treatment if you don't have a known donor that you can use. The other big issue for lesbian healthcare is that for the majority of women in this country, there's 2 reasons they go to the doctor. Any ideas about what the first one is? Trying not to get pregnant, right? So birth control usage. And what's the second one? Trying to get pregnant. So for lesbians, when you don't have this pressing need to be on the pill or the ring, I'm a sex educator too, so I can't stop myself. Lesbians just don't get as much preventative care because we're not worried about accidental pregnancy. What we also see for gay men, this is coming up a lot in the healthcare reform debate as we're sitting at these really large progressive tables with women's groups, with choice groups, and they're talking about the need to have gender-specific care, right? Because a lot of times women's healthcare needs around pregnancy prevention can get cut out of insurance because it's thought of as being expensive. And they'll say things like, what's the problem with gender-specific care? Obviously, like, it's not like a man needs a pap. And I'm like, actually, for men who have sex with men, be they gay, bisexual, or non-identifying, they actually do need anal paps, right? Especially for the receptive partner. And frankly, for a woman who's having anal sex, she should also be having an anal pap. But when you say that healthcare reform needs to cover gender-specific care, you're automatically excluding out men who have sex with men. So we'll talk about that need. For bisexual individuals, it's the ability to actually find healthcare that recognizes that bisexuality exists, right? That you can go in and say, you know what, I'm 19 and I'm having sex with men and I need to be on the birth control pill, and then to go back at 21 and to say I'm not having sex with men anymore, I'm only having sex with women, or for example, trans men, I don't need to be on the pill anymore, and have a doctor who can talk to you about what safe sex looks like in those situations. And then the last one I want to talk about is transgender care, which is a large and can be very complicated. What really comes down to transgender care for individuals around preventative care is the fact that trans men will need through their entire lives, regardless of what kind of surgery they get, they're going to need to have breast examinations the same way that a biological woman would. And for a lot of trans men in this country in particular, they don't have what people think of as bottom surgery, right? So they maintain physical aspects of femaleness in their genitals, and that means you're going to need to have things like cervical care. For transgender women, no matter what kind of surgeries they have, they're going to need to have prostate examinations. And what we find happens when people transition legally is that if insurance says you are a woman, I cover pap smears, you are a man, I cover prostate exams, when that man becomes a woman legally and medically, all at once that service isn't covered anymore. So a lot of our providers have to talk through how not to commit insurance fraud while still getting these preventative services covered. And that's a really difficult thing when you're transgender. You may be scared to go to the doctor with good reason to begin with, and then you're going to have to worry about paying more out of pocket. The other thing, I just want to say about trans care. So that's kind of what it comes down to around trans care for preventative services. It's also the fact that our government doesn't take a big role in knowing what happens. So a lot of times people will call the coalition and say, like, my son told me that he's transgender, I'm fine with the fact that he's a man now, but I'm really freaked out about what taking hormones is going to do to his body, right? And the response that we have to give is, I can't give you good information, because there are no, in the United States, long-term studies about what the impact of taking testosterone or estrogen does to a person's body. And that's a really, obviously, huge problem. Questions about the basics of preventative? So what we're finding is this need to explain what LGBT care looks like to people who are allies, who are quasi-allies, and people who are really uncomfortable talking about what sex and sexuality looks like. And it's kind of this odd, lovely place where we're actually having to work a lot with women's groups for the first time, because the three big issues that healthcare reform is going to come down to and be most controversial. Can anyone guess what one is?
Abortion.
Abortion is one, two.
Birth control.
Nope, going to the LG. So it's abortion is a women's issue. Birth control they're not as worried about, which is kind of weird, but you think they would be. For LGBT, any ideas?
Immigration.
Immigration is actually the third. And the second one is whether or not they're going to cover transgender-related care. And as soon as people say transgender-related care, what people automatically go to is sex reassignment surgery. But the reality is the majority of people in this country don't get sex reassignment surgery, and insurance companies routinely have what we call a rider. So there'll be a line, the same way they used to do for women, we do not cover birth control pills, we will now say we do not cover transition-related services. So you think, oh, that cuts out sex reassignment surgery, that's a problem, but it doesn't sound as horrific as it could be. But what really makes it horrific is that insurance companies, as they are apt to do, expand that out to everything. So I'm going to steal this example from Mara Kiesling, who's the executive director of the National Center for Transgender Equality, and she talks about a call that they got from a woman, a transgender woman, who broke her arm playing softball in a women's softball league, and the insurance would not cover it. Because what they said to her was, if you hadn't transitioned into being a woman, you would not be playing on a lesbian softball team, and therefore you would not have broken your arm.
Wow.
Right? But that's what insurance companies do in a lot of areas, and that's how they're going to extend out transition-related care.